So I know this is a random question, but if I moved to the Yukon, do you think it would be cooler?
Not for long.
The heat, man. I'm just not a heat person.
Crowley is toasty. It gets pretty warm down there.
Yeah, I read it's going to be 106 down in Bishop on Sunday.
Wow.
Yeah, see, the Yukon is looking good, isn't it?
They were talking 90s for South Lake Tahoe on this weekend.
Oh, really?
It'll be just perfect here. I finally like it when we get those few warm days.
Yeah.
It's good for my 2 tomatoes.
How are they doing? Are you still protected?
They're very beautiful. They're very beautiful. They're about this big each. I hope they taste good because every day I talk to them. And
Have you had any bats down there?
just in my fireplace.
Do you see them flying at night though? Out by
Yeah, there's a lot of bats. Yes, lately.
I like bats. They eat a lot of mosquitoes.
Yep. Unfortunately, they don't eat the yellow jackets.
They don't. Poor thing.
Are we ready? I have no idea what time it is here. Oh, we should get going.
Yeah,
Justin, you want to kick us off or do you want me to?
Sure, I can. We just want to
Cool.
welcome everybody to the July 8th New Normal, Coping in a COVID World. Thanks everybody for stepping back on with us. We've got our panelists all lining up and getting ready here, and I'm going to kick it off by handing it over to Robin. But first I want to explain some of the features of the webinar. So you'll see in the bottom of your screen, there's a chat button as well as a Q&A button. As we kind of proceed and we kind of discuss things, there may be URLs or links that we want to put into the chat feature, one of the panelists does, and so you can look there for information. It'll pop up red when something gets added there. But we're really interested in having an open conversation. This is really conversational. We really want to know kind of what you're thinking, ask questions. And so that's what we've got that Q&A for down in the bottom as well, the Q&A bubble. Feel free to go ahead and put your question in there. You can also raise your hand virtually and you can ask a question that way. We can unmute you and you can ask it live and in person. We do encourage participation. We know it's a little bit, may feel a little bit uncomfortable, but that's what we're here to talk about. So please feel free. And with that, I will kick it off with Mono County Behavioral Health Director, Robin Roberts.
Good evening. So on the coping in a COVID world, I'm learning new skills, and one will be whether or not I can follow a PowerPoint, which I'm not super great at. But thanks to Stephanie Valadez for putting together the PowerPoint. We have a few panelists tonight. We have Cassandra Montez, we have Stephanie Valadez, Justin Caparuso, Sheriff Ingrid Braun, and Linda Salcido, who is the interim health director and also mayor pro tem for the town of Mammoth Lakes. So we're going to start you off a little, with a PowerPoint, lots of good colors and some humor, but also to talk about a little bit of what we've learned in the last 2 weeks. And also the last 2 times, sorry, we meet every other week. And also how we can create more resistance and more resilience within our own selves in order to manage what has become a really stressful time. So we're calling this series The New Normal, which whatever that means anymore, it keeps changing, and that's part of the issue, coping in a COVID world. Am I the only boomer on, oh no, Linda, you and I, like, now I'm gonna go beep. That means you changed the slide, Stephanie, thank you. So here is what it looks like these days, the group hug. As we've learned, one of the things we've learned from Beth Cohen is we're hardwired for connection. We're hardwired to be in groups. That's how humans survive. And we are hardwired to be connected to people and each other in order to be able to survive, but also to thrive. We're in this very weird situation right now with COVID where we're being asked to stay away from people even though we're craving people. And I would say that some of us are probably smudging on our rules that we started with a little bit because we're really missing the connections that we have with the people that we love, or just with any human, actually. So I don't know if you have had these experiences, but like if you go to the post office and you recognize someone in their mask and you want to say hi to them, we move towards one another. That's what we do. We move towards one another to get close, to have a conversation, to make eye contact. That's all part of being human. And now we're in the situation where moving towards people can make us very anxious, or being around people at all can make us very anxious. And so that is part of what we're going to talk about today, and also just part of what we're dealing with on the daily when we're trying to cope in this COVID world. Beep. So first, we want to start by thanking all the essential workers in our community. And that's everyone from doctors and nurses and medical providers and dentists and law enforcement and EMTs to the people who work in the grocery stores and the retail stores, the post office, the gas stations, campgrounds. It goes on and on and on. We've had 9 new positive cases in the last 4 days, 2 presumptive. That's 11 in a very, very short period of time. And it has been, as we learned yesterday at the Board of Supervisors meeting, with essential workers. So people who are on the front lines dealing with the public. So just to really notice the people that you deal with. If you are a public worker, if you go out into the public and you're dealing with workers, please thank them. Please show kindness to them. Don't talk to them about your beliefs about masks or whether people are wearing masks or not wearing masks. Maybe talk to them about how they're doing, and thank them, because they're in the front lines right now, no matter what they're doing, and they're being the most affected by COVID right now here in Mono County. Beep. So what we learned from Beth Cohen, and what you may know already, is that we have a limbic system in our brain, and I'm not the scientist that Beth is, so I'm going to explain this in my own way, the Robin Roberts behavioral health way. When you get freaked out or scared, you go into what's called flight, fight, or freeze. And if you stay in that position, fight, flight, or freeze, for a long period of time, like you're not just running away from the tiger, as we say, because that's biologically what we have it for. If we stay in the limbic system for too long, we start to create patterns in our brain that make us feel overwhelmed and unable to cope with sometimes the smallest things, and unable to sleep, and all other matter of things that we'll get to. But if we stay into the limbic system for too long, it can start to feel like trauma. And what happens then is people get into the potential for self-harm. Beep. So if you're in your limbic system for too long in the fight, flight, or freeze, you have an increase in stress, you have an increase in your cortisol. And what can happen, one of the ways you can know that that's happening for you, is that you decrease enjoyment, you start to feel more irritable about things, your startle response will be heightened, the ability to manage your stressors, to sleep, etc., goes down or up, depending on what the thing is, exponentially. So I don't know about you, and we can talk about this as a panel, but just the other day, something happened where this literally happened. A leaf fell from one of the aspen trees in my yard, of which I have many, and it scared me in a way that felt like somebody had stood next to me and fired a gun. So that's my startle response. And that was when I said, oh gosh, I guess I'm a little anxious. I didn't really feel all that anxious because I've gotten used to living in this state. But I noticed when the leaf got too close to me that I had my startle response so heightened that I'm actually quite anxious. I also notice it where I might get a little more irritable with myself or with my dogs, or sometimes with a coworker, outside of my normal character of irritability. And then I really have to struggle to get myself into a place where I'm managing that stress. And how we can do that is get some fresh air. Know how you're feeling. So the image you see here, excited, sad, angry, sick, if you aren't very well versed, or you want to become more versed in feelings, you can look up, just Google feeling charts, and it will show you something like this, where you can decide at any given moment, like, how am I feeling? So you don't need the leaf to scare you and think that you've had an explosion next to your head. You can just start to realize, like, I need to check in with myself and notice how I'm doing. You can keep a schedule. A sleep schedule is the most important schedule that we can keep. Sleep is the most important part of what resets our cortisol levels and resets ourselves when we're feeling stressed or overstressed. For those of you that are having trouble sleeping, even just resting is important. You can make connection. That's the thing I want to talk about the most as we move along here, is making connection with people, reaching in, making connection. One of the things I've taken to recently is looking through my contacts on my phone and realizing there's a lot of people in there that I haven't talked to in a very, very long time, some people for years, and just reaching out and saying, hey, I'm thinking about you, what's going on? Sometimes it's a short conversation or text, sometimes it's longer. But creating a world, like remembering this large world of connection and the interweb connections that we have with people, is a really important way to help us manage stress. And another one that we can do that Beth talked about last time, because breathing is free, is managing your breath. So doing controlled meditative exercises. If you don't like the word meditation, you can just call it controlled breathing, where you spend 5 minutes of your day breathing in and breathing out and trying to calm your mind. And if you do it at the same time every day, if you can manage that, it starts to reset your brain and reset your cortisol levels, which is what we're really trying to do here. We're in this for the long haul. I think that COVID is going to be around for quite a while. It could be that we end up in situations where this gets worse in Mono County. It could be that it doesn't, but if it does, and I think a lot of us are starting to worry about what happens next, is, again, that puts us in flight, fight, and freeze. And it's important to be thinking about your future, but at the same time, it's very, very, very important to manage your stress. For those of you that are into the news, whether you read it or you watch it, or you get it through the radio or whatever, managing that input is also very, very, very important. And so if you start, like for instance, it's kind of hard to have road rage here. However, it does happen. At least a friend told me that. And if you're listening to a radio station and the news comes on and you start to get mad, or you start to feel like you just can't take it anymore, you feel like you start to speed, that's because you're starting to feel stressed that you don't have a way to get out of your body. So you can either turn the radio off, or you can manage your stress by managing your breathing. Beep. So Beth talked about maladaptive behaviors, and I wanted to focus on this a little bit. Maladaptive behaviors are when you're doing something that's not adapting to your situation or your circumstance or your life in a way that enhances it. So maladaptive is something that happens, it works against your well-being over time. So I want to make sure that we're not shaming anybody or making anybody feel badly about trying to adapt to this crazy, unbelievably weird situation that COVID has brought us. And if you're doing things that you feel badly about, or you feel like, well, I shouldn't be doing this, let's kind of re-look at that a little bit. So it's normal to be in a high rate of upset right now. It's normal to feel like you can't get away from COVID. Don't know about you, but most conversations I have with friends or family, we end up talking about COVID, and it gets old after a while, and it gets to us after a while. So if you're drinking or using drugs, or these are kind of the ones that we typically focus on in the US here, is drinking, using drugs, using anger to communicate, child abuse or domestic violence. Those are just a few of what we call, quote, maladaptive behaviors. Those are signs of trauma and stress. And that when you know that there's a problem for yourself is when you're not connecting with others because you're drinking more, or you're using drugs, or you use anger in such a way that people don't want to be around you. And so again, it all comes back to, how connected am I feeling to people? If I add bits of connection every day, and that could be for 5 minutes every day, then it will start to readjust your brain so that some of these adaptive behaviors won't have the mal in front of them. So lots of us drink, use drugs, lots of us can get angry, not lots of us abuse children or cause domestic violence, but when you do those things, it's because you're probably feeling a level of stress that you can't seem to recircuit. And it also can bring up the feelings of past traumas that you might have had in your life right now. If you've ever felt stuck or lost or overwhelmed, this is a time when those feelings are going to be heightened. So, of course, there's lots of ways to be able to manage what we call maladaptive. But what I want to hope leave people with today is, if you're not feeling connected to people and you're doing any of these things as a result of that, do a little tiny bit less of those things every day and add in a little bit of connection every day, and that will start to reset your brain. Beep. So, finding ways to connect. Again, we're in this really odd situation where we want to be around people. That's normal and natural. It's something that most of us do, even those of us that are super introverted. We want to be able to move towards people when we see them in the store or the post office or at the gas station or out hiking. And yet that creates a fear inside of us. So what are other ways we can create connection that might not be perfect, but also add to reducing our stress and just add to our sense of well-being? So reaching out would be me reaching out to one of you to say, I would like to connect with you. And I might not say it quite like that. I might just say, hey, how you doing? Or can I talk to you for a minute about something? Or how was your day today? Reaching in is when I call people or make connection with the people that I know and care about, especially if I know they're having a hard time. But even if I just want to reach in and just say, hey, how are you doing? Like I said, going through my contacts and making connections with some people that I haven't talked to in years, and just sending them a text and say, hey, I'm thinking about you. That's reaching in. That's finding the people in our lives that we want to connect with. Finding meaning in your life. Meaning and purpose came up at the last time we talked. And how do we do that? We can do that either by helping other people, by learning something new. We can do that by being kind and thoughtful when we're working with one of the essential workers. Any kind of meaningful, kind, purposefully caring conversation that we have right now is vital and important to our community. So that will help us be resilient. It will help us be creative. You can be creative by writing letters. You can be creative by being on a Zoom meeting or FaceTime or Facebook Live or all those different things. The idea is to make connection. Beep. So I work for Monroe County Behavioral Health, as do a few more of us here on this panel. We are here for you. Our phone number is posted right here on this slide. We have an after hours access line as well. We're open right now 7 days a week. I'm here to talk to you. We do all the crisis intervention. We are concerned about you if you are feeling suicidal, and we are here to help you if you are. And we're also here to help people who are concerned about people who might be suicidal. We can help walk you through some ideas about how to make connection with people who are really struggling right now. We also have a nurses line. So obviously, if you're feeling sick, you can talk to a nurse, you can learn about testing and resources and what we have through the 211 line. And beep, suicide prevention. This is a good number to have. They can also help walk you through if you're worried about someone in your life who might be feeling suicidal. And of course, if you are as well. And that's it. And there's all my beautiful people. So thank you. Do we have any questions in our question and answer box?
We currently don't have any questions. Just as a reminder, the Q&A box is down at the bottom there. Feel free to pop a question in there or raise your hand in the chat. We can call on you with any questions. For now, do we want to go to panelists?
Yeah.
With some feedback and insight on the PowerPoint?
Robin, something you said resonated with me about feeling angst, I guess, or anxious and not realizing. So, you know, the leads bit startled you. 2 weeks ago, actually almost 2 weeks ago, I went up to Horseshoe because I opened for the first time just to give my dog a little swim. And there's so many people, and I hadn't seen so many people like that.
Right.
And I didn't realize how edgy that made me feel, because I don't know these people, and I don't know where they've been, and I don't know what they're breathing. And it took me a while. And I usually let my dog off leash because she's super friendly and dorky and wants to run up and meet people, but then I have to run up and meet people, and I didn't want to meet people.
Right.
It was weird. I texted you about it,
Right.
and it's
It's super
taken
weird.
me some getting used to, because now there's more people in town. The people in town, the people in Bridgeport, the people everywhere, and you have to get used to interacting with people that you don't know. I mean, it was kind of nice on our island in the bubble for a while.
Yeah.
Yeah.
So we have a hand raised.
Oh, go ahead.
I'm going to go ahead and unmute Joyce. I think we might know who this is.
Oh no, Joyce, Aunt Joyce?
I think it might be. Joyce,
Awesome.
you've been unmuted.
It's me. Yes, I do want to say that the breathing exercise that you encouraged last week was amazing, and I have been using that, and really does calm me down. So I just wanted to thank you for that. It's
Thank you.
really helped me a lot.
Good. Thank you. Where are you, Joyce? Where are you located?
Whoop, are you still there?
Uh-huh. Could you not hear me?
No. Try it again.
Oh, can you hear me now?
Yep.
Okay. I just wanted to say that the breathing exercise was really helpful to me, and I practice it every day. It just, I can just feel me calming down. It's great. Thank you so much.
Thank you. Thank you for your comment.
Absolutely.
Linda, you're going to say something?
Yeah. In the last, since Monday, we've had new cases, as you referenced, and I find myself anxious about that, not just for me, because, we've been in our house, we've been pretty limited. We've stayed very close. We go very few places. And so I find myself like not wanting to do anything. Like, I don't even want to go to the post office because it feels like it's more here. We had that long period of time where we didn't have any really cases. And I know now that we have these cases and we're doing contact investigations, and a lot of that's going on. And I find myself worried, not just for myself, but for, like people that are working, people are out there amongst it, people who need to go to work, who don't want to stay home, restaurants that don't want to close. And, I find myself then looking at news from Florida and Arizona and thinking, oh my goodness, so it's like, it feels more edgy right now to me.
Linda, you know what, we're from the communication side of things, we're getting a lot of, there's a lot of sort of unknown about what contact tracing is and the importance of it. Can you maybe just take 2 minutes to explain why it's so important and what the results lead to?
Of course, thank you for that reminder. When we identify, we being public health people, identify a case. So if Robin were suddenly to be positive, then the health department in the county
I'm not going to sleep now.
I know, right? I had to use you. It had to be you. And,
Sorry, go ahead.
So then we would call her and interview her and say, share with us the people who you have been in contact with in the last period of time, in close contact. She may say, well, I walked through Vaughn's, or I went to the post office, or I had 2 people over on my balcony to have dinner, and we were closer than 6 feet and we didn't take our masks off. So then those would be what we consider to be close, non-family, if you will, non-close contact. You have maybe people you live with, so those are your closer contacts. And then, then they would then say, okay, well, we need to check with those 2 people. And so, we would quarantine, Robin, she'd have to stay inside and pass the days off. And then they might call us and say, well, you were in close contact with a case. And I would say, oh, yes, you're right, we will. we were. And so then we would need to be, self-quarantined for, the 2-week period, 10 to 14, so it's like that's the contact tracing. And if you have a case that maybe was working and was in touch with a lot of people and went, to a wedding and all the people there, and then went out and went to a restaurant and ate indoors, suddenly you can have 20, 30 contacts very quickly. So it can get intense really quickly. So when we say contact tracing and investigation, that's what that means.
Yeah, thank you. And then that data then leads to decision making on sort of how to address things in the community.
And that is really driven by factors such as cases, how big the contact tracing has gotten, and then particularly looking at hospitalizations and hospital admissions, especially in communities bigger, much larger than ours. Those are the things you begin to look at particularly closely.
And that's a good segue to a question that we have right now in the queue about the hospital saying that they're currently green, the status is green. And so they want to know, the increase in cases has not required hospitalizations.
That's correct. We have not had any patients admitted to the hospital since we've had the uptick in cases. That's correct.
Great, thank you.
But remember too, we're doing a lot more testing, and then you begin to look at how many tests you've done and what is your rate of positivity around that. And that number escapes me at the moment, but that's another
2%-ish.
Yeah.
It's under 3%.
Yeah. And so that's not, that doesn't begin to turn us into one of those, counties of concern. We're still pretty far from that level.
So let's talk about this a little bit, because I was around some people this weekend, more than I've been since March. I mean, I have the good fortune to be able to work from home. So, and I don't really like to be around people all that much. So it kind of works for me, even though I also really love people, right? So I was around some people this weekend, and there were 3 things that happened that were kind of surprised me. Number one is, it's not easy to keep 6 foot of distance all the time. It's not easy to keep 10 foot distance all the time, or keep your mask on all the time if you're having more than an interaction like you might at the Vons or hospital, or at the Mono Market or whatever, the Monocone. And you have to have everybody cooperate. And one of the things we're hearing in our workplace is, and trying to help people with, is helping them set limits and boundaries with family and friends who maybe don't believe that this is an issue, or feel that because they're family and friends that they're still in the same germ family. And it really puts a lot of pressure on I had to explain things to people that they thought they understood, because they're not in the middle of it like we are, right? The whole 6 foot thing is like, no, really, it's all the time. And no, I don't want to share food. And, but we're family. Yeah, but we're not a germ family. We were a germ family like when we were growing up together, but we're not a germ family now, because we haven't been in the same proximity as everyone for the last 14 days or longer. And we don't know everybody's test status. And I found it tiring, actually, and a little bit overwhelming at times, depending kind of who I was dealing with. But really, I had to call people off all the time. Like, you're too close to me. Oh yeah, I'm sorry, I forget, And it's also strange. But I do think that we're all dealing with that in different ways, right? Trying to make those decisions.
I'd like to know if anybody on the panel, or particularly in the audience, does anybody have bubble people? Do you have a group that you kind of call your bubble people?
No, apparently not.
Okay, just me. Okay.
Well, I do have a bubble people.
Oh.
They're actually like my friends who I started with. In the last meeting we had, I talked about staying connected, and we talked about Zoom calls. And I had mentioned my connection with my closest friends was Fridays. Fridays are for friends. So we actually decided, this is a small group. We're talking about 5-6 people. And we actually, because we all worked in the restaurant hospitality and interacting with people, we all got tested. And we decided to take, we communicated with each other and we said, okay, let's hang out, go outdoors, and practice social distancing. So yes, I think there's ways we can all practice social distancing. Of course, it's hard to tell them you're too close to me, but I mean, it is my bubble people now because I've seen them at least, once or twice within the last, 2-3 weeks. So I think it's being mutual about the situation. And as we talk about communicating, I think we should always communicate with the people we want to, interact with and be like, this is our precautions, and maybe finding the balance in between of what does this social distancing and our germ family come about. So I think it's something we can always interact or put it out there with whoever, we want to become close in contact with.
Mm-hmm.
We also had bubble
Go
people,
ahead.
another family that we were interacting with, distanced and stuff, but swimming at their pool with their kids and kind of being separate, but as much as we could. But they started cheating on us, sort of, with others. So we've been distancing from them a little bit, just because, so we've had that conversation. It was very much like, is this exclusive or is it not?
It's complicated, right?
It's complicated. It's embarrassing. It's uncomfortable.
Yep.
And you have to, like you said, respect everybody however they want to handle it.
That's true. Cheating on you. That's great.
Hey, we have we have quite a number of participants out there listening to us. We do have the Q&A box. We'd love for you to participate. You can do it anonymously and just even say, like, who are your bubble people, your germ family, or what do you call it? Do you have some cool names that you call the people that you hang out with? And how do you know they're exclusive, and what's it like having those conversations? And especially for those of you that have kids, little kids, what's that experience like?
Yeah, I'll speak to it a little bit, Robin. I have an 8-year-old and a 2-year-old, and I often see them, looking out the window when the neighbors' kids are playing outside, and we're a little bit more protective of them. So it's really hard, especially right now. They're out of school, the older one, so there's not a whole lot to keep her busy. If anyone has any ideas to keep an 8-year-old and a 2-year-old busy, please let me know. The weather definitely does help to, get them out and take them to the park or, just the trails. But it definitely is hard to keep them entertained and, trying to limit the amount of time they spend in front of the screen as well, because that's also another concern of ours is, how much time are they spending either on the tablet or watching TV, and trying to I guess kind of substitute that connection, right? Because it's a lot harder for the kids to make that connection than it is for us adults and pick up the phone and call someone else.
So have you found any kinds of things that are working or helping?
Let's see. We've tried rock painting. That's an interesting one. There's plenty of rocks around here. So we've tried rock painting. We've gone on hikes on the weekends. The kids love those. But during the week when both parents are working, that's kind of where we're struggling a little bit more to keep them entertained here inside at home.
Anybody else? Ingrid, do you have a bubble family?
Yeah, I do. We have some neighbors that we're really tight with that have been over, and I have to tell you, I'm probably a little more lax than others are. We all take different calculated risks. I'll own that. I did go down to LA and pick up my dad and fly up to hang out with my sisters over the weekend. And
That's
so
right.
that is my family, but they also, we're all hundreds of miles apart. So I can't tell you where they've been this whole time. Oh, my older sister's been in her home in Wallala. I know she hasn't been anywhere, but it's part of taking a calculated risk and knowing your family and keeping distance and assessing their, just assessing someone's health as you look at them. And I worried after I got back, taking my 84-year-old father on a trip. Was that stupid? Did I endanger him? And obsessively, almost, not obsessively, but I never used to check my own temperature, but now I check my own temperature. If I'm not sick, then he's not going to get sick. Mm-hmm. And I woke up this morning feeling kind of crappy. I don't have a fever. I run really cold. My temperature was like 96. And I still don't have a fever. I know that I don't have the COVID, or the Rona as the kids call it. But it still gave me some discomfort, thinking, did I get my dad sick? Was that calculated risk worth it? And I got to tell you, hanging out with my family for 5 days was totally worth it. We hadn't seen each other in forever. But it's scary at the same time to put yourself out there like that. So I do have bubble people.
And that's, I think, Ingrid, what you're talking about totally makes sense, right? Because we have this situation where we are all making calculated risks. And then the desire to go do that thing is so strong. And then the kind of the backwash wave is like, oh no, was it worth it? And then you have to wait 14 days to know if it was worth it or not, right?
Yeah. I'm 1 week in, so I'm feeling pretty good about it.
Yeah, but I think that we all have that on our minds, and that it, maybe we're all good communicators and we can just talk about it out loud, but I think that is part of what we're talking with people about, is these things are very, very hard. And then if you have the workers who are going to work every day and coming home, and they end up in an environment where someone's tested positive, and they're worried about bringing it home every day to their kids or their spouses or the people that they live with, like that is a pressure and a worry that I think, of course I'm going to say this because of my experience in the world and my job and the things that matter to me the most, but naming things and talking about it really does make it better. When, like in my situation, which was my calculated risk, was to say, this is not a disease I want. And if I have it, I don't want to give it to somebody, right? And so, okay. And then people go, oh, okay. And then they kind of would back off for a few more minutes, and then we'd have to rearrange our 10 feet or whatever. But it's stressful,
Yeah.
It's a stressful thing for all of us to be dealing with. And I think it's also the other side of that coin it's something we're all dealing with all the time. And it's so unusual for a community to be having a conversation about the same thing for this length of period of time. That's unprecedented. So there's also some strengths in that, I think, that we have, which is we're all a community right now. I know most of you. I didn't know Justin before this, but I feel like you're part of my Zoom bubble. Not that that's as fun, but, but at the same time, I feel like I could talk to any of you about this, and you would have your own experience. We might do different things around it. We might calculate risk differently, but we could all talk about that together. And that's unprecedented in our communities. We've not had these experiences before around disasters for about 15 days, but not for, what we're into 4 months now.
Yeah,
there's some strengths in that, I think, if we use them. That's why talking nicely and being kind and asking your server or your checker or your postal worker or whoever, how are you today? How's it been? When I go to do my recycling and just say, how are people treating you okay? That makes people feel good. They feel like a person in this, and those kinds of things matter. And we can all do that. All of us, all the listeners, all of us, we can do that every day.
And Robin, I'm glad you said that, because I went, it was last week, I went to Giovanni's to pick up a pizza, and I was early. So I had my mask on, everybody else had masks on, everybody was doing what they were supposed to do. The people who were eating obviously didn't have masks on, because you can't eat with a mask on. That's one of the exceptions. And I was waiting and everything was fine. But it turns out that like half an hour later, somebody was upset that people were eating without masks on. And I don't know what the expectation was, but completely lost it on the owner and called her outside and screamed at her. And it was, she reached out to me because she'd seen me there. And so she's a neighbor, and she's also knows who I am, and said, what am I doing wrong? what have I, how can I make this right? And I said, these are the things that you need to do. These are the expectations. You're doing everything right. And your role as an owner is to have people follow the rules, remind them when they slip, because people slip, and then 86 them when they won't comply, and then call law enforcement if people get belligerent. And she said, okay, I feel much better now. But that whole being kind to someone, to understand and put yourself in their position. She's a business owner trying to run a business, doing everything she can, and she can't control everybody, but she was doing a really good job.
Right.
So it's just so hard. I can't even imagine trying to be a business owner right now, trying to get your business back on its feet, trying to follow all the rules and do everything you're supposed to do, and then worry about bringing it home to your family and worry about your employees and your customers. And I couldn't even deal with that stress level. And I deal with the stress stuff.
It's so interesting, going back to Robin's presentation, Ingrid, that reminded me, I wrote down a note about control. And on 4th of July, my neighborhood went out of control with fireworks. And it was one of those where there's so much out of my control right now. One more thing kind of put me over the edge. And I feel like some of those people, like you just referenced, they go out and they see, it's just this, there's so much out of our control right now that one more thing kind of just is the tipping point.
Yeah. 4th of July night, I had to go remind the neighbors that you're in a residential neighborhood. It was somebody's kids that were up borrowing the dad's house or whatever, partying late into the night, that your neighbors have jobs and kids, and I won't tell you what I told them to do, but I wasn't kind, but they weren't kind either. So it's hard. It's really hard to be nice to someone when they're not being nice to you.
Well, as we're talking about control, and I just want to chime in on this, I worked in the restaurant industry, and when people are asking, how are you dealing with this COVID thing? You're back on board. Sometimes asking these kind of questions are not necessarily appropriate for these people, because now they're concerned about going home if they have contracted COVID, or, whoever's breathed on them, because they're taking off their mask and they're just speaking and not following through. And also being, people, of course, we forget about where we're living in. We forget about what times we're living in. But also, too, I feel like it's important that people should understand that we should probably think about how are we going to treat the people who are essential workers, who are front of the line, and ask them appropriate things, because not everyone is there by choice, but everyone's there is to, you got to feed your family. You're there because it's the way it is. So we definitely have to control our ways. I mean, everyone slips up, as you said, but as people don't understand is that there is a fine line where we need to understand where people are going through as well.
Yeah.
And it goes back to what we talked about, setting boundaries for what you're comfortable with. So if you walk into a restaurant and you're not comfortable with the way that they're handling it, then walk out.
Right.
Just set your own boundaries. You don't have to eat there. There are choices you can make. And you don't have to yell at somebody else because they've made you uncomfortable. Remove yourself from that situation if you can. I feel for anybody that's in a service industry right now, where they're working because they have to work, they have to feed their families, and it's probably super stressful to deal with that. And my heart goes out to them.
Kindness goes a long way. Yeah. So let's talk a little bit. We have a little bit more time and no questions. So again, to the audience out there, use the QA box. We would love to hear from you. You can do it anonymously, or you can call in like Joyce did and tell us, what do you have questions? Do you have thoughts? What are you doing? How are you doing this? How are you managing? How's it going? What are you doing around resilience? So if we could talk a little bit about what each of us do on the daily to keep ourselves balanced. Okay, how about the weekly? What each of us do, what we used to do a year ago to keep ourselves,
I can go. I'll go.
Okay.
I've been taking notes, obviously, but I really need to get myself back into some sort of a schedule. Obviously, we're all working from home now. I feel like there's such a blur in terms of what a day actually is these days. especially with, and Stephanie, I don't know if you agree, but since the kids have been out of even their Zoom school structure, it's just been difficult. But my gym did open up a couple months back or 6 weeks ago, and that has been a good routine for me to at least start getting back into doing. And then a lot of walks. The walks have been huge. And my wife and I will just leave in the afternoon or evening, walk the dog, leave the kids at home, 15 minutes. Everyone's out doing that. So you see people from far away, you can wave, you can talk from across the street, which is kind of nice. So those things have been helping, but I do really need to refocus on a routine and a schedule.
I want to point out something that's important about this is just doing something differently for 5 minutes a day makes a difference. You know, we live in a culture that's about whatever, losing 50 pounds or getting in rip-roaring shape, or, you know, it's all these big goals. And really what we're talking about is add something in once a day for 5 minutes, and it really does make a difference. You know, I can't walk for 3 miles, so I'm not going to go do anything kind of thing. That doesn't work. Just go for 5 minutes. Go ahead, Stephanie.
Yeah, one thing that we've also been doing is just taking drives. You know, sometimes the wind is horrible, so we just take the kids out and just go out for a drive. The new thing we implemented is usually at nighttime we started watching a comedy show. So we got tired of the news, we got tired of the dramatic movies, so we every night we watch about 1 or 2 comedy shows, and it really just lightens up the mood, and it gives you just something else to think about, because you know, just like Justin was saying, sometimes you reach that tipping point where you're like, I don't know if I can handle another thing. You know, I've shared this, you know, I'm currently pregnant, I'm in my 2nd trimester, so it's like, what a perfect time to get pregnant in the middle of a pandemic, right? So there is that you know, that other layer to, you know, not only dealing with the pandemic, dealing with the kids at home, but now, you know, just being pregnant. And so just simple things like watching a comedy show at the end of the day, you know, you're just kind of, I don't feel like talking. I don't, you know, because I've done the connecting thing, and I think I kind of overdid it. My mom calls about 5 times a day now. So it's like, okay, a little bit too connected, Mom, but it helps her, right? Because she, you know, she feels lonely, so she calls me. But at nighttime, you know, that's us time. We watch our comedy show, and we just relax. So it's really been helping us right before we go to bed.
Do any of you turn off your phones at a certain time?
I can't.
I
I'm on
can't.
call.
Me too.
Yeah.
I do set my personal phone and actually my work phone so that text messages and email noises don't come through after certain hours. I'll still get phone calls, but yeah, I turn off the texting and the emailing.
Yeah, I do that. Good.
Yeah, likewise. After 8 p.m., do not disturb on iPhone comes on, so I don't receive unless it's an emergency. I have certain contacts like my parents or family members are living here who are able to still send me a message or a phone call. So
It's a great feature, huh?
Absolutely.
It is.
Yeah.
It is.
What about the rest of you?
I've started reading more. I used to read a lot. And then I don't have time, or I read things that are for work. I read a lot of, you know, work stuff, and I don't read for pleasure as much. And so I'm learning to set aside time to do that and really enjoying that, and remembering how I used to read like a book a week. I'm lucky if I read a book a year.
I've been writing more, personal writing. And then I go on walks. I have dogs, so I go out with the dogs. And then I do this thing where every 5 minutes I do what I call a 360. So I just do a turnaround. I mean, we live in the most amazing place in the world. So anywhere you go, that if you just do a 360 and just look at, just try to remind myself, like, this is all here, and it'll all be here when this is over. And just to really try to enjoy it. I mean, I think that's another way of saying is I try to give my brain a break from, I try to give my brain go to what also feels normal, which is all these other things that I did before COVID and things I'm still doing through COVID. Those are my normal routines, and I just make them, I try to talk to myself about how they're normal and just not think about COVID. And also, frankly, with some friends, nobody here on this panel, I have certain friends that are just obsessed with COVID, and they watch all these news sources and they read all this stuff and they want to talk to me about it. And I have a certain cutting off point where I'm just like, I don't want any more information about this. I feel like I know everything I need to know to do my job for my county and take care of myself and my, lecture my family members because I'm the oldest. But outside of that, I don't need more. I don't need to know how it's going in, some part of Florida. I know what the trends are. That's the other thing is that's the other limit I think I set is I don't want to know your information too after a while. I mean, a certain point. Linda, what do you do? What did you used to do before?
I think that the phone thing is big. I have not been practicing that lately, but only letting yourself look at email like once an hour. You can do other stuff in between. You can work, you can do all that, and then save your email till that time. I have not been, actually, that's what I've not been doing. I just kind of stay up on it because it's, really a lot of email and you just don't want to get behind it. But by the end of the evening, it's like make dinner, sit down to eat it, and then don't, shut the phone off. I'm not going to, answer a phone call during dinner. And then often, which I've done for most of my life, is I really like to take a hot bath at night. It's really nice to soak in and just kind of relax in that. So that's always been my go-to, reward at the end of the day. It's kind of like, okay, just short, not like a long, hour-long soak, but just a nice little wash off the day and start over. Yeah.
Nice.
Yeah, that's kind of what I do.
We have a question, which I think is really interesting. It's something I encountered last week as well. How do you handle interior home maintenance, such as appliance repair, painting? I guess if you all of a sudden need someone to come into your home, have any of you encountered that?
My husband fixed a door lock today. He taught himself how to do it. He was very impressed and said, "You have a future." We have hired, we did some outside painting. We have a friend who is also a professional painter. He came over and did that, but that's outside, not interacting. We haven't had to have anybody come inside. So, yeah, I don't know. I suppose they're required as much as anybody else to do all the precautions and wear a mask. And I don't know.
I've had one interaction with, not in a maladaptive way. I do drink alcohol on occasion, and I got some alcohol and I had to sign for it. And the guy just came right into my house was up in the dog's yard. He just literally came up to my front door and said, I need you to sign this. He didn't have a mask on or anything. And I said, you need to back up and I'm not going to sign. We got another thing about it. But then I've had I've been considering painting, because the other thing is wanting to hire people to do some work, I feel like, okay, I want to try to, participate in my economy the best that I can. And so had a conversation around, here's what I would need in order for it to be safe. And again, I have all this privilege. So I would just leave for that day. Like I'd go work somewhere else for the day and not be here and keep all the windows open so the house is aired out. And then I'd probably worry about it. But I also think that there's a lot of people, at least that I've talked to, who they want to, they don't know me, so they don't want me to, because I am the infected one tonight, to infect them, right? And they want to keep their business going and they want to, do the right thing, and so they're being careful and safe. I don't know. What about the rest of you?
So I actually had someone come in. I live in an apartment complex, so I guess it's our annual thing of checking windows. And I had someone come up. He was wearing a mask. He was pretty much distance-wise. And he said he needed to come indoors and check all of our windows. Actually, I was like, what's the procedure? He's like, actually, if you don't mind, or whoever's in this home, open up all your windows. And then it's not going to take more than 5 minutes if you can step outside, which I thought was really
Oh,
nice
perfect.
of him. So I actually opened all the windows in every room, and he went in there, did his thing, and I still kept them open, and it was really, it was good. I think I had a really positive experience because he made sure, you know, I don't know if I'm exposing him or he's exposing me. So
Right.
it was really good, and I actually made a good review of the company who came in because I was like, they're making sure they're doing protocols. So it's nice to know people are actually out there taking the precautions and understanding where we're all coming from.
Anybody else?
I think I don't think I've had anybody in my house besides.
Hey, shh, 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 shh. That's an interesting question. Did the question asker say anything about what their experience is?
Not, but if they would like to type more, and if we can maybe address it in a different way.
No, again, I think it's all about making yourself, deciding what you're willing to risk, and then asserting yourself. And, you know, if you don't feel comfortable asserting yourself, finding somebody, and we all have somebody in our lives who's that person, right? Who's much more assertive than we might be in certain situations. Have them take care of it for you. That's what I would do.
I wonder what the things are that people are willing to risk their lives for, like a haircut, you know, going out to a restaurant. I don't know, just, you know, I'd like that would be a great poll. Like, you know, what are the 2 things you would risk your life for?
Yeah. Sushi.
Hugging your grandchild, you know,
Yeah.
going to see your mom. Yeah.
So Linda, I've had my hair cut, and that was fine. It's a local person. She wore a mask. I wore a mask, which I thought would be weird to get my hair cut while wearing a mask. And it worked totally fine. Everything was great. So I have done that. I've done the haircut, and I've only been out to dinner, like sit down in a restaurant once, and that was outdoor when things first opened up, and I haven't done it since. I don't know that I do a lot of takeout.
Yeah.
I really want to support businesses doing a lot of takeout.
Right.
I don't want to go sit down with strangers.
I know the thought of the 2 things that freak me out is getting on an airplane, like you did bravely, you know, and then secondly is in an indoor restaurant. Both of those things just sound like not enjoyable, like not really. I mean, I think I'd be so tense that it would be not fun.
So the flying experience was not horrible. It was Burbank to Oakland and on Southwest, and with my elderly father. So we got to pre-board. Southwest is very strict about the rules, about everybody wearing masks, nobody taking middle seats, everybody giving each other space. They handed out cups of water that you watch them sanitize and pour, and little packets of snacks. And it was fine. And there was something I heard on the news about the air on an airplane is probably better than the air in your grocery store right now. They're doing so much with it. But and the airports were pretty empty, and people were good about wearing masks and keeping their distance. And I learned a new term, not just a new way of saying it, because social distancing sounded vague. Physical distancing sounds awkward. Keep a healthy distance. I heard that one recently. So now that we all know that it's 6 feet, we can just call it a healthy distance. If anybody who doesn't know it's 6 feet, they haven't been paying attention.
They steal that. I like that.
Yeah.
Healthy
Well, you can steal it. I stole it from somewhere else. So.
I think the biggest driver is loneliness and desire for connection. So, you know, I do think that that's where we step over our lines that we draw. We have another question?
We have, so the last question clarified, and she or he says, they all came in with masks. I stayed 6 feet away. For one, I hid out in a bedroom, but when I came out, they had taken off their masks while using their mobile phones to text and email during drying time. I did open all the windows and sliders and sanitize anything they could touch and turn on all my air purifiers through the night, plus wore my mask for 2 hours after they left. I'm so worried about the White House and how divisive things are. Sounds like the precautions, you responded appropriately.
Yep.
Yeah.
And yeah, division's not going to get us anywhere. That whole thing about staying kind, best we can. Is there more? We good?
That's it.
Okay. So we're going to keep doing this. The next one is July 22nd. We're going to do it every other week. We're happy to add people to our panel if there's people out there who would, Joyce, if people who'd like to join us on the panel, we would love to have you. As you can see, you don't have to be an expert. You just have to be a person who's willing to talk a little bit about your own experiences so that we all feel like we're part of one community. And I want to thank all of the panelists and Olivia for being our tech IT person who's done a great job. Justin, always thanking you to be here with us. It's a pleasure. Any last thoughts?
If anybody has any suggestions or topics they'd like covered, you can email covid19help@mono.ca.gov or go to the coronavirus website, which is monohealth.com/coronavirus, and email us, and we'd be happy to provide you with the information you're looking for. So go there, and that'd be great.
Yeah.
Maybe we should have the first 10 minutes next week. We're going to talk about the funniest things that's happened to you during COVID. And the panelists have to come up with something and ask the audience, our participants, to each come up with something too and quickly put it in, because I think that'd be good to start with a giggle next time.
I like that.
Yeah.
As long as it's appropriate, I suppose.
Oh, now, come on.
After hours. It's after 5.
Yeah. Yeah.
Happy hour.
Yeah.
Yeah. Okay, let's do that. That's a deal. We'll do that on the 22nd of July at 5:30. We will be here, and we would love to hear your anecdotes as well. Thanks, everybody. I love seeing you. Thank you for being a part of my community. And we'll see you next time.
Bye.
Stay well.
Bye.
Bye.